So it's my pleasure to talk a little bit about the OR Core on behalf of myself and Dr. Peavy, and of course, Stina and Emily and our social worker, Tracy Constructive. So we have 4 aims, which are highlight the interconnectedness, I think, of the OR Core and the work that we do. So our first aim really is around recruitment, developing and implementing sustainable strategies for recruitment of both participants and study partners, and ensuring participation from those underrepresented groups, as well as aim 2, where we're more into outreach and educating community members, but also healthcare professionals, and the importance of ADRD research. And then, of course, engagement in aim 3. And we engage with our participants and the caregivers, but also students and our colleagues in healthcare. And then aim 4 is to track the success and look at the metrics of all of that. So this figure is really just to get at the complexity and interconnectedness of what we do. So to highlight a couple of key accomplishments since our last meeting, one is definitely in the recruitment of a couple of really engaged members of our core. So Mariana and Camilla have joined as retention specialists and a research liaison. And they've been instrumental in getting us up on our numbers, both in recruitment and retention, both bilingual, of course, and cross-funded by the DBCID and Clarity. So they've been very, very important new members who I'll highlight as we go along. They are meeting with people in our memory clinic, they're meeting with people in the community, they're very passionate about what they do. For aim 2, we have some ongoing events every month. We have a very rich calendar, but we've also added these Brain Blast series via YouTube, which are not quite going viral, but close. And then aim 3, we have the engagement, we have a new support group. So our support groups are incredibly well attended and very popular. The research participation is not a requirement, so it's kind of a give back to the community. And we added an ADRD bereavement support group that Tracy runs, in addition to the ongoing groups for early stage dementia and caregivers, and one specifically for LBDA. And that's been very well received. And then for aim 4, we have several papers as well as different ways to track statistics. And I just wanted to highlight some of our publications. So 5 new publications and 7 under review from the writing group. So that's been quite successful, including one led by Sphinx Latar on the recruitment strategies in the Promotora group, which really shows the integration across our different cores. So we have met our goals with recruitment. So for the last RPPR period, we recruited 67 people, and this slide really just breaks down where those people came from. So several different strategies depending on who we're trying to recruit and where we're recruiting from. But largely it's been very successful, both from previously existing streams and some newer ones too. And something that we've really been trying to improve and highlight is the flow from our memory clinic, which is co-located with where we test the ADRC participants here at UCSD, and trying to make that easier and more direct. So that's something that our new staff have been very helpful with. We've also noticed much better agreement for biomarkers with our new bilingual recruitment specialists working in this integrated way with our own clinic and clinics and in the community, and also directly with the community. And I think the return of results has helped a lot with that as well. To talk a little bit about how we integrate with the other cores in the top half of this slide. So we're really integrated with everyone. With the clinical core, we work on recruitment streams and processes. the return of the results brochure development, with the data core, we work with both recruitment and referral tracking and the new system that Diane talked about, the formerly known as Latino Core. We talk about the Promotora program and Latino outreach, engagement and recruitment. With the administrative core, we facilitate the transportation and compensation of our participants. With the biomarker core, we're always working to streamline recruitment as well as educational biomarker descriptions, making sure that we're communicating things well with our participants. And the neuropath core, there's the planning of the CPC conferences, enhancing brain autopsy agreement, and the clinical core presentations. So there's really a lot of cross-core impact. I did want to highlight that paper that Svinka wrote, but most of what we do involves several other cores on a daily basis. We also collaborate and integrate with groups outside of the ADRC, so several groups within UCSD. So there's our own clinic that I already mentioned. We also have a clinical trials unit. I lead the Women Information and Tau studies with Erin Sunderman, and we collaborate quite a bit on recruitment. One of those studies focuses entirely on Black African American women. So we've led some events, and our program manager and Christina and Emily are always talking about opportunities to get into that community and do sort of co-lead talks and presentations. And that's been quite successful. Other multi-site studies, including some that you've heard about today. So the DLB Consortium, SCAN, ADME, P30, we have a lot of co-enrollment across all of those programs. And other investigators, Emily mentioned several earlier. She's one of them, of course, with her study on ARIA. And external to UCSD, we work with several of the local clinics and groups, including Kaiser and Scripps, Sharp, the Neuron Clinic, of course, and then the Alzheimer's Association, Alzheimer's San Diego, and the Lewy Body Disease Association. So we're very well integrated, both within the ADRC, within UCSD, and within the community more generally. Some challenges that we've faced in the last year. You've heard a little bit about the other studies that we're trying to help recruit for, with the Lewy Body Disease fluctuations and late. So we're going to need more non-AD cases. We do have this new collaboration with movement disorders, specifically Dr. Coughlin, who you heard from earlier, and the Memory Clinic partnership continues to improve. And of course, some of the more unusual forms of Alzheimer's, forms of neurodegeneration often come through those specialized centers. Recruiting locally outside our specialist clinic. So we know that there's a lot of participants or potential participants with MCI in our community here at UCSD who are seeking health care, and only a very small fraction of those will come to our specialized clinic. So how do we get to people who might carry that diagnosis but aren't being seen by one of our clinicians? We've tried this program called the Data Extraction Concierge Service, which is embedded in our medical record. And it's been a little complicated, I think, on our initial tries. We get a ton of potential participants who've agreed to be contacted, but whittling them down to people who are still alive and still wanting to participate and don't have new diseases or disorders that might be barriers is complicated. So we're working with that. And one thing that we've been discussing is potentially creating some kind of research recruitment tool, which would be built directly into Epic, which could help us quite a bit. Along those lines, technology could definitely enhance participant communication. So outgoing communication in a HIPAA compliant manner. We talk to our patients with MyChart. Is there a way that we could do that with our participants as well? The quality of life programs or support groups I mentioned earlier, and other groups, other events going into the community are generally underfunded. But given the overwhelming need in our community. So when we see patients in clinic, whether or not they're interested or eligible to join the ADRC, they're very, very interested in these programs. We'd love to offer more of that and be able to cover that base a little bit more. The promotores and recruitment and retention roles were of huge help, but we're a little bit vulnerable there because they are cross-funded from these other studies, and what would happen if that funding went away. So looking ahead, of course, we want to diversify. I mean, I've said that word. We want to broaden our reach into other neurodegenerative disorders, including late and DLB. We want to continue to collaborate and grow with the memory clinic. We've discussed how busy the clinicians are and how little time they have with the patients already. So how do we make that as smooth and easy both for the patients and the clinicians? And some questions for you. We were wondering if you knew of ways that people are leveraging technology, perhaps AI, to improve outreach and recruitment to communicate with our participants. And also, we do have a big, of course, an important focus on our Latino community here, being a border city, but we also have other forms of breadth. And we're already working with the Asian community. So Gary is involved in the ACAD study and the Black African American community. We have our Black Women of Inflammation and Tau study. So we're often discussing as a group sort of ways, how much should we focus on building out the outreach to those communities more specifically versus maintaining our status quo. So thank you.